releases estrogen, and it releases progesterone. Okay? And those are feedbacks to the pituitary gland when pregnancy has occurred to stop producing FSH, okay, follicle stimulating hormone. Here's the ovary. It's a reproductive organ, and it's also an endocrine gland. Okay. As an endocrine gland, what kind of tissue makes up most of it? Glandular epithelium. Okay, hear the word gland, glandular epithelium. This is the infundibulum, also known as the os fimbriae. It's a tube, like a claw, and it does have ciliated cells. They're simple columnar, but they're ciliated. You don't have to know that. Its function, though, is to capture an expelled ovum and bring it into the oviduct. This is the oviduct, also known as fallopian tube. In the cat, again, you can call it the horn of the uterus. The oviduct is the usual site of fertilization, right here. And then the fertilized egg, which would become a zygote, immediately on becoming fertilized, travels to the uterus, right here. And in the uterus, it implants. And if that happens, then you have a pregnancy that can go all the way or not at all. Take this apart. The inner layer of the uterus is the endometrium. That's the wall that is inner wall that is prepared to receive the zygote and deteriorates if there isn't implantation. Behind it, this larger area is myometrium, smooth muscle, which is going to contract during childbirth. Oxytocin is the primary hormone that causes that. I'm trying to mix a little the lecture in the lab here at the same time, if you don't mind. I mean, if it bothers you, we won't do it. Okay. I never mentioned to you the outer wall, just these inner two. The uterus does have rugae at the distal end. Distal? This isn't an arm. But it's, again, towards the direction that things will be traveling. So this is the distal end. Hyaline cartilage makes up the cervical wall that separates the uterus and the vagina. It shows a bit better on this model, on this side, because it doesn't have the pin going through. There's the cervix. The vagina has rugae. The bladder, located right underneath the uterus, empties through the urethra. Both the urethral opening and the vaginal opening are in close proximity. And in this area here, between these skin folds, labia or minora and labia majora, the outer one, larger one, the majora, and the smaller one, the minora. Between these folds, this area is the urogenital sinus. Urogenital sinus. I know the reproductive models get used heavily. That means about 3 times, 3 stations on the test. So you get a male for sure, you'll get a female, you probably get one or the other. But that's all that you could be asked on this. On the lecture test, no, we're not doing serous membranes, but I showed you on the cat, I showed you the broad ligament the other night on Monday, and that attaches the oviduct and the ovary to the body wall. The broad ligament's not represented here. Guys.